Hello everyone, this is Dr. Shameem. I am a breast cancer specialist and a general surgeon and proctologist working in Mavin Medical Center, Banjara Hills. Today we will know about galactosile. This is the most common lump seen in breastfeeding women. During breastfeeding, there can be lump formations and the lump could be of any cause, either a fibroadenoma or breast abscesses or galactosiles or even cancer, entity called pregnancy associated breast cancer. So, if you feel a lump while breastfeeding, don't ignore, get evaluated. When you are getting evaluated, the most important is triple assessment. That implies getting examined by your doctor, and once your doctor sees you and gives a provisional diagnosis, imaging technology like ultrasonography to rule out the of the lump, and third one is an tissue diagnosis either by FNAC or a core biopsy, which will give you a definitive diagnosis of what the lump would be. So, once you feel a lump while breastfeeding, you have to get yourself evaluated by your doctor with an ultrasound as well as by FNAC or a biopsy. Once you get to know that you have a galactosile, the next step is you have to know why the galactosiles form. The reason behind might be either improper feeding techniques, improper positioning of the baby, or improper feeding because of baby's irregular cleft palate syndromes, or because of any trauma, either because of any injury or because of previous surgeries, either for breast reduction or breast augmentation surgeries, can predispose to develop a galactosile. Apart from these two, the third reason can be any infection or inflammation or nipple irregularities like nipple inversion, which might predispose for obstruction of the duct and formation of galactosile. Once you are diagnosed having a galactosile, the treatment would be either just conservative treatment with medicines, or it could be an aspiration with a syringe. And if even after aspiration there is a recurrence of collection, or if the galactosile is growing, or if it gets infected, forming an infected galactosile, then surgical excision becomes mandatory. And once it has been surgically excised, usually it does not come back. So, once you know the causes of galactosile, it is important to have a proper positioning of the baby while feeding, and if you feel any lumps during breastfeeding, to get it evaluated as early as possible. Mastitis means infection of breast. An infection of breast could be of acute type, which is happening only over few weeks time, few days time, and formation of pus discharge. Whereas on the contrary, there is another entity called chronic mastitis, in which the infection lasts for a longer duration of more than 4 to 6 weeks. And when there is a chronic infection in the breast, which is called as chronic mastitis, patient suffers with the chronic symptoms like pain in the breast, lump formation, pus discharge, or sinus formation, and nipple discharges. So, what is the difference between an acute infection and a chronic mastitis? The difference is the chronic mastitis, the infection does not resolve with the use of antibiotics or even after drainage of abscess. There have been many cases, many patients who presents with multiple scars of repeated incision and drainage for abscess done, and there is a recurrence of the infection with formation of multiple sinuses discharging the pus. So, it is important to keep in mind that there is a special entity called chronic mastitis, which could be because of granulomatous mastitis. This granulomatous mastitis again can be because of either tuberculous infection, TB breast, which is called as TB breast, or it could be an idiopathic granulomatous mastitis where the cause is unknown it could be of autoimmune origin. How to know whether you have a chronic mastitis or granulomatous mastitis? One, if the infection is not resolving with a routine treatment like drainage of the abscess or use of antibiotics, we have to suspect it could be a chronic mastitis. And or else if there is a recurrent episodes of infection in the breast, or if there are multiple sinus formations with a pus discharge, or if the wound takes a longer time to heal, and if the lump or pus reoccurs even after the surgery, then we have to rule out whether it could be a chronic mastitis. How to know whether that is granulomatous mastitis? We need to do triple assessment again. One, examination by your breast surgeon. Second, by an ultrasound imaging or a mammographic imaging of the breast. Third, by a tissue diagnosis, where we will require a tissue biopsy of the lump or of the tissue to know whether there are any granulomatous formations in the histopathology that will confirm that it is granulomatous mastitis. If you have granulomatous mastitis, it is important to rule out if there is a tuberculosis infection, and if the tuberculosis infection is ruled out, then it is idiopathic granulomatous mastitis, in which we will require additional treatment of steroids and other medicines along with surgery, or even we can avoid surgery and give this steroids and additional treatments. So this is to be kept in mind that not all granulomatous mastitis are because of tuberculosis, and if it is idiopathic, we will require a further evaluation and management. Thank you. Hope you all get evaluated early and treated early. Thank you once again.